I'm Kelly Pilcher. I'm here to do my Module 2 IV push video. The first thing we're going to do is we're going to assess our order from the provider. We're going to go into the electronic MAR to make sure that we know what we're giving. In this case, the order is for 20 milligrams of furosemide IV push. It's to be given PRN for weight gain above 3 pounds in a 24-hour period or symptoms of fluid overload to be given over 2 minutes. We're going to say that it's be given now, so we're going to go ahead and do that. So the first thing I'm going to do is perform hand hygiene before I collect all my supplies. We're going to have our dummy arm, our hand sanitizer, our gloves, our furosemide, 2 IV pushes, a syringe and a needle to draw up, and alcohol, prep pads, and I always have tape and pen and scissors in case I need to use them for anything. Once we do that, we're going to go into our Pyxis or our med room. We're going to pull out the med. This is a vial of practice furosemide. This bottle is 100 milligrams. It's 10 milligrams per ml. Our order is for 20 milligrams, so we're going to draw up 2 mLs. You're going to check the expiration date. In this case, it's 10 of 2029, so we're fine on that front. Now we're going to draw it up. I'm going to go ahead and perform hand hygiene. Me, myself, I put on gloves when I draw up meds. That's just how I do it. Gotta make sure your hands are dry first. So in our case, our kit has 10 ml flushes, and we only need 3 mLs to flush prior to giving the med and after. So what I do is when I open my syringes, my flushes, because they come packaged, you open your package, you want to stay aseptic, you're going to take your cap off and you're going to dispose of the extra fluid, so you have 3 mLs in this syringe, so you're not giving too much or too little when you're flushing before and after giving the medication. You're going to do that with both syringes. Then you're going to open your syringe and you're going to open your needle. In this case, I'm using a 25 gauge because that's all I was given in my kit, and I'm using a 3 ml syringe because that's all I was given in my kit. You're going to stay aseptic, so you're not touching anything, so it stays sterile. You're going to attach the needle. You're going to make sure that you have what you need, 2 milligrams of air in there prior to doing it. Then you're going to take your vial and you're going to take an alcohol pad and you're going to clean the top of the vial for 10-15 seconds. You want to make sure it's very clean. You don't want it contaminated in any way prior to drawing it up. You're going to take your cap off. You're going to insert it into the vial. You're going to push the air in. You're going to invert it, and then you're going to make sure that the needle stays in the solution, and you're going to draw up how much you need. Again, in this case, the order is for 20 milligrams, and the vial is 100 milligrams. That's 10 milligrams per ml. So we're going to be drawing up 2 mLs for the dose that we need for our patient, Ellen Davis. So you're going to go ahead, make sure there's no air bubbles. In this case, we don't have any. That's like unheard of. So you're going to have these. I'm going to label it. When I draw something up, it's in a syringe. I don't know what it is. We might only be giving 1, but what if we were giving more than 1? Furosemide, 20 milligrams, 2 mLs. Just label it. Then I'm going to get rid of any trash I might have. I'm going to clean up anything. I'm going to put, if it's a multi-dose vial, you're going to put it back in your Pyxis or whatnot. And then you're going to be ready and prepared to go into the room. So we're ready, prepared. We're going to take our flushes and our meds. We're going to go into the room. We're going to introduce ourselves. Hi, I'm Kelly. I'm your nurse today. I'm here to give you your medicine. Could you please tell me your name and date of birth? You're going to check what she tells you against her wristband. Her name is Ellen Davis. Her date of birth is 9/19/1965. You're going to ask her if she has any allergies. Even though you've already checked that in your electronic system, you're still going to do that. Upon doing that, you're going to, when you go into your room, you're going to perform hand hygiene again. Always do that every time you go into the room. After you've identified her, you've cleaned your hands, you're going to explain what you're doing. Today we're giving you a furosemide IV push in your line. I'm going to flush first to make sure that it's still patent and that it's working properly. I'm going to give you the med. It's going to be over 2 minutes. Then I'm going to flush it again for you. So after going over that with her, I'm going to put on clean gloves. I'm going to assess her arm and IV site to make sure that there's no swelling, no pain, no anything that would indicate that we would need to use a different site. She feels fine. It looks great. We're going to continue. So you have 2 flushes, one before, one after, and your medication. Before you do anything, you're going to open a new alcohol swab and you're going to clean the port vigorously for 10 to 15 seconds. You want to make sure it's nice and clean. You're not putting anything dirty in. You want to, don't want anything to get infected. You're going to keep aseptic and you're going to take the cap off your first flush. You're going to attach it to the port. You're going to gently pull back on the plunger to see if you get any blood to make sure that it's still patent. We're going to pretend that we did, and we're going to go ahead and flush with 3 mLs of fluid. And then we're going to dispose of that. Now we're going to get another alcohol prep pad. We're going to clean it again for another 10 to 15 seconds. At this point, we're going to be giving the medication. We're going to take the needle off and we're going to attach the medication to the port. Now, at this point, you will need to utilize your watch with a second hand. You need to be giving it over 2 minutes. So it's a slow push. So we have 2 minutes to give 2 mLs. So it's important that you don't go too fast or too slow. I'm sure she may have some questions, but you have to keep making sure that you're watching your watch, just to make sure that you don't go over or too soon. You want to make sure that it is at least 2 minutes before, that's the order, so we got to follow it. Then once you're done giving it over the 2 minutes, you detach. You're going to get another alcohol prep pad. You're going to clean it again prior to giving the last flush. Stay aseptic. You're going to take the cap off. You're going to cap it. And then you're going to flush with the normal saline to make sure everything actually is in the patient and not sitting in the tube. You want to give them the full dose. You're going to make sure that you dispose of your sharps and anything that needs to be disposed of in your sharps container. Everything else you're going to throw away in the trash can. Perform hand hygiene, make sure you're nice and clean. Okay, at this point, you're going to make sure that nothing has come out of the IV all over. It's actually gone in. You're assessing the site, making sure there's no reaction. And then we're good to go. At this point, you're going to then do your documentation. As long as you're documenting everything, then you should be good to go. I always go back into a room.